All right, Tanisha, we are live. That button in the middle that says you're live means that we're live, and we're normally 20 seconds, me and you, before it hits the social media platforms. So there'll be a little bit of a delay, but welcome to Tea Talks. We're happy to have you here. We know you're doing a lot of work in our local community, and we wanted to use this opportunity to introduce you, to our audience and to get a chance to hear what you're doing, about your journey, why you're doing it, your con, all of those wonderful stuff that we're going to get into today. So
Okay.
I'm going to give you a moment now to just introduce yourself and the name of your organization. I know your name is there, but introduce who you are and we'll ask you some questions.
Okay. Good afternoon, everyone. My name is Tenecia Burton-Sproul. I am the founder and executive director of the Pink Queen Foundation. I am also a breast cancer survivor. This is my 11th year, or should they call it what, cancerversary. Um,
Yeah.
I was diagnosed at the age of 37. And at that time, I was a full time employee, mom, wife, mother of two young children, and going on, going on the cancer journey and just getting through the journey and still trying to balance it all. And the Pink Queen Foundation was, I would say, it was my pain to purpose unexpected mission that I was called to travel on and to impact and help those that are about to embark the journey, or those that are on the journey, or connect with families that have their loved one has transitioned because they lost their battle on the journey. So that's how we started. So I can tell you more as the time, ask questions, and I'll tell you anything you would like to know.
Tanisha, you said in your bio that we know about your journey. We know that you were diagnosed very young, as cancer goes, still young, mom of kids. And you said that starting the Pink Queen Foundation was part of your healing. And I want to talk about it a little bit because there's many responses to getting a diagnosis, okay? And one of the response is I want to hide, I want to run, I want to retreat, I want to not talk about it, and that's a normal response for a lot of people. Do you believe that in doing the Pink Queen Foundation is big in becoming an advocate, how do you think that's part of your healing? Because you mentioned it's part of your healing.
Yeah, I think hiding and just kind of shying away from the journey is like almost like a sin. You're doing yourself a disservice. So the first thing you have to do, and what I did, is you have to accept the fact that it is what it is. You've been diagnosed with breast cancer, and it's okay not to be okay. And talking about it, reaching out, it only is going to help you get through the journey, and also connect with others that can possibly understand what you're going through. But when you try to internalize and keep something, a diagnosis like this, private and quiet, it's like eating you up on the inside, because there are so many unknowns and questions. And most people that are like keeping it within and keeping it quiet, they're on the internet looking for a solution, where sometimes that's the last place to go, is the internet. So I definitely would tell people, do not shy away from talking about it. I mean, you don't have to parade around and blast it everywhere that you've been diagnosed, but don't be ashamed. It's okay to reach out, to let someone know that I'm not okay. I need support. And when I
Hmm.
say support, it does not all the time means financial. Emotional support is just as essential as financial support, spiritual support. Those are two main supports. When you get that diagnosis, that financial, and I mean not that financial, that spiritual and emotional support is so essential. You
Yeah.
get that, you can tackle the financial part of things. But when your spirits are low and just not balanced, the whole journey diagnosis is not going to be healthy.
I know you're a woman of faith, so I'm going to talk about it in a little bit. But who was there for you when you were diagnosed? Where did you get your help from? I mean, I know you probably went to your faith community, but where did you get your help from when you were diagnosed? Because you use your diagnosis and that journey to start your own nonprofit and become this advocate, and I know we're going to talk about some of the services that you offer, which is, I know it's emotional, spiritual, financial. I know you also offer, some other, things to comfort. You work a lot with kids. So, but just tell me a little bit, when you were diagnosed, who was there for you? Was there an agency? Oh,
So when I was first diagnosed, I was actually working. I'm a 25-year employee with the Palm Beach County Sheriff's Office. So, I mean, in working 40 hours a week, that's like your family. So when I first got my diagnosis, I went to my chain of command and informed him, and he assured me that I would not walk the journey alone. And when I tell you, I was out of work for about 10 months. The agency, they pulled together the various departments. They donated time, my sick and vacation. A couple of coworkers would bring over hot meals, and it was just so warm. I didn't have to like literally worry or stress about the financial aspect of things. So that was I was, and I'm still grateful for my work family for coming in and stepping in and making sure that I didn't miss a paycheck. So that's what was covered for me. As far as the emotional support, I was at the time the first person in my family diagnosed with cancer. So I had no clue about cancer at all. I mean, I knew I knew the word, I knew of chemotherapy, but I didn't know of radiation. I didn't know of mastectomy, lumpectomy, none of that stuff. So it was kind of like going in the wilderness, because I had friends and I had family, but I think my friends, they were more supporting on the financial side. But they didn't know how to support me emotionally. So some of my friends, they kind of, they kind of shied away a little bit.
yeah.
Because you don't really know how to help someone in a time like this. And but they were there, with the kid, helping with the kids and things like that. But as far as like getting down, going to the doctor's appointments, trying to figure this stuff out, in an overwhelming state of mind. My mom was there, but my mom has her own health issues, so she wasn't really able to hear a lot of things to kind of help me get through the journey. But she was there, to help with the chores and stuff like that. But being able to advocate and know the questions to ask the doctor is like that was my biggest setback. And I learned that along along the journey, and also the journey of others is
Yes.
helping me help with advocacy.
That's a good point. Our founder, Sarah, she says, afternoon, I'm so happy to hear your pain to purpose mission. While we don't choose suffering, we always have a chance to make it a gift to others who are suffering.
Yes.
You said something, one of the things that we talk about at Total Health, it's one aspect of self-advocacy and education. Like you said, there was no one in your family who had cancer. We all know about cancer because it's everywhere on TV, but knowing how to ask the right questions was tough. And as you said, during your own journey, you had that challenge. And as you're helping others now, you're seeing that challenge. And hopefully, because you've walked through it, you are now able to tell, I'm sure, inform the people who are coming to you, some of what they can ask. So tell us exactly what the Pink Queen Foundation does. So a woman who is diagnosed, newly diagnosed, and she calls your agency, she calls your nonprofit, what can she expect?
Okay, and just to tell you, when people call us, this organization is pretty much built word of mouth. We have not had to like go out there on the manhunt looking for cancer survivors. They're just being referred to us left and right, and when they initially contact us, we direct them to our website. to fill out our questionnaire. We screen the application to learn what type of cancer they have. And then from there, we'll more than likely we email them to let them know that we're going to review the application and we'll get back to you within 2 weeks. And once we do that, we do contact them to find out first how you're doing.
Mm-hmm.
What do you need? Because not everybody that contacts our office need financial support. Some people they need someone to go to the doctor with them. They want to know like what to ask the doctor. And some people they need assistance with child care, or they need, can someone come and help? Do you have services to help with to clean the home? Because I've had the mastectomy, and a lot of our clients, they are single parents, and we seldom have men that contact us. And it's not just breast cancer, although when you see our organization, you think of the pink ribbon, but cancer comes in all colors. It's like a color wheel. So everyone's need is different, and that's why we don't treat everyone the same, because everyone's need is different. But when a typical mom call and says she don't know where to begin, or the first thing I ask them when they say, well, I've been diagnosed with breast cancer, I say, well, what stage?
Mm-hmm.
They may say stage 2 or stage 3. I say, what type? They say breast cancer. I say, no.
Mm-hmm.
You need to know what type of cancer you have. That's very important. And a lot of younger survivors, they don't. They don't. And I say, if you can't even pronounce the name, have your doctor write it down. I say it's important, because you want to make sure you're getting the right treatment. And once you get that name, your diagnosis, then you can probably go online and start doing your research to see what are the treatment options. Because some, not all, but some, they just think it's just breast cancer. And I was like, no, you need to know your type of cancer. And sadly, some doctors, they won't even tell you, if they'll just pretty much tell you how they're gonna treat you, and they come up with a treatment plan. But if you don't ask the questions that need to be asked, sometimes you don't know, so you have to be able to advocate. So that's something that I really assess to see how well they know about the type of cancer that they have.
That is so important. Like you said, when I got diagnosed, I was the first in my family too with this sort of thing. And so who knew about ER, positive, negative, PR, HER? Who knows? You only hear breast cancer. So you on the outside think all breast cancers are the same, right? Who knew about staging, stage 1B, C, D, and, all this different stuff. So education is key. So I'm glad that you're able to push back and ask those questions so that they can go to the doctor more informed. Because I think part of the issue why there's so much disparities in healthcare, especially among underrepresented groups, is because of the lack of knowledge, right? The lack of education about the disease. So if we're not asking the doctors these intelligent questions, they're making assumptions that the patient doesn't get it. And here's what we're going to do. And I think one of the biggest thing that you could do, and I'm glad you're doing, Tenecia, is educating these women that there are different types of cancer. There different staging. Do you talk about clinical trial at all to your with your women? Do you?
Actually, I just really learned about a clinical trial. I attended American Cancer Society. They had a workshop down in Davie, which is in the Fort Lauderdale area.
Mm-hmm.
And that was one of the questions I asked, because because one of my cancer survivors, her cancer was so aggressive, so the doctors had given up on her over here, but she had to do her own research to try to find somewhere where she can go to get a second opinion. So she had to go to Tampa, and she did go through a clinical trial. So I asked the American Cancer Society, well, why is it not clinical trial is made available to people that may qualify, because a lot of they don't we don't know much about it. So they did give me a website where you can go to inquire about the clinical trials, but I think there need to be more information available so that people, including myself, will be able to assist those that are kind of like at the end stages of their cancer, and they need clinical, they need to go to a clinical trial. So that's something that is very important and needs to be kind of put out there.
I'm so glad I asked that question, right? Because this is what we're hearing. We're hearing about the lack of representation in clinical trials for underrepresented groups, especially Black women. And, and of course, the death rate among Black women is, with certain types of cancer is 40% higher than white women, right? And here's what's intriguing to me, right? That you're doing so much good work in the community, right? You have all the community people, right? The local people, the people who are unseen. You're getting them because you are word of mouth. You've helped someone. I know you were an MC recently for a young woman who has a foundation in her mom's name, because that young person, actually, you helped them while their mom was going through that situation and actually passed away. And so you're part of your client's life, right? You're part of their lives. But here's what's so intriguing and upsetting to me is that you're just finding out about clinical trials, right? You've gone through 11, you're celebrating your 11th year, clean, and you're doing this great work. I think your foundation is about what, 8 years old, maybe.
2016. What is that? 7, 8 years, something like
7
that.
to 8 years old, right? And clinical trial is something that is still almost unattainable, almost,
Taboo. You don't hear about it.
You don't hear about it.
Yeah.
And hence is the problem. And we're trying to debug why aren't Black women hearing about clinical trials. You've met with many patients and they've never heard of clinical trial because their doctors aren't saying anything to them about clinical trial. So if we as advocates don't bring it up, it's like it's not said. So I think Peter, who's one of the scientists, well, he asked two questions. Says, we all know that it can be confusing finding information online. Where did you go to find out more about your cancer and your treatment?
Actually, when I was diagnosed, I did Google. I just Googled breast cancer, and I think I just started reading different blogs. I really didn't know at that time. I didn't know what I was reading. I didn't, because I still didn't know much about cancer, and it could be very overwhelming. So I just kind of did a Google search, and I mean, I was reading stuff, but I had no clue at the time what I was, reading and trying to process, until actually I started going through the journey. And then that's when the questions would arise. And, so it just, I was like I said, I was just in the wilderness finding my way through, because I didn't really know anyone that personally that went through cancer. I mean, I knew of, distance, friends, relatives, and things like that, but no one that I can put my hand on that had went through cancer at that time. So, yeah.
What was, we're not gonna call names, but was your doctor, everyone has different stories about their care team. How would you rate your care team in terms of educating you and being supportive and empathetic?
Back then, I would say my care team, it was not good. It wasn't really. I was like the middle person amongst my radiologist, my hematologist, the breast surgeon, and the plastic surgeon. There was no team. It was me relaying the information. Yeah, they would get the records, but there was really no team. And now things it's gotten better with that. But because like I had to change my plastic surgeon, because things were just didn't go right. So I had to get a second opinion and go see another plastic surgeon, and he had to kind of, correct the problem. There was a big problem, and it's like my breast surgeon. She was great, but I don't think she was aggressive enough, and she just kind of she did her part. One thing I can say that she didn't do, because I didn't know the difference between lumpectomy and mastectomy, and she pretty much gave me the options, but she didn't encourage me like how to make that decision.
Mm-hmm.
And I just feel like when someone doesn't really, you give them the pros and the cons. Okay, if you get a lumpectomy, this is what to expect. Mastectomy, this is what to expect. So I did eventually get the mastectomy, but I wish she would have told me to go ahead and get both breasts removed. She didn't tell me that. She just removed that one breast. Then we found spots in the other breast, but they were benign. But then I said, no, let's just move the breast. So had I known, I would have got both breasts, did a double at one time and not, at different intervals. So back then, the communication was horrible, and and it's because I was persistent, and I was concerned about my health, that I knew that I needed to get records. And
Mm-hmm.
the most important thing I'll tell people, if you're unsure, always get your records. Whether you understand what there's is saying, get it on a CD or disc or something. Get your records, because that's the black and white print. So yeah, it was tough for me, but now they're working more. The cancer physicians are coming together with treatment plans, and they're all are working together. But when I was going through it, it's like I was from A to M to Z,
Yeah.
and I had to kind of put everything together and make sense of it all, because they weren't really. Um, I mean, the only two doctors that I know that really communicated was the plastic surgeon and the breast surgeon, and that was during the time of surgery. Other than that, I was really on my own with,
Mm.
yeah.
Wow, that's rough. Well, yeah, like I said, hopefully there's some improvement along the way over the last 10 years. For the Pink Queen Foundation, for someone listening, what are your greatest needs? Because I know you are a grassroots advocacy group. I know you work with a lot of volunteers. I know you're kind of funded. So what's on your wish list?
Um, because we are growing extremely, and like I said, we're pretty much volunteer based, and funding is definitely a big challenge of ours. We do have some foundations that are supporting us, but if we can get more like grant writers to come on board, you know um, people that are professionals that are in the financial department, more so, and marketing, people that can come in to kind of that know about running a business. Well, nonprofit is
Hmm.
pretty much
It's a
like
business. Yes.
it's a business, but someone that has that experience, and just can come on and want to give of their time, or want to help us try to get unrestricted funding and general funding and all of that stuff, so that we can get a staff, because we are just is through the roof. You would think that we are a well established large organization with the work that we're doing. It's like um, we do get in-kind donations for our baskets. We definitely need that, and also with our bridging families on the cancer journey. What we do is we bring in chefs to help with teach the children how to make healthy meals, fun meals that they can make for the family. Like our last session, they made taco salads,
Hmm.
and they just learned the different ways you can make salad and make it fun. So, different chefs. We had a chef come in to do smoothies, to talk
Hmm.
about the different fruits, the difference between processed fruit, sugary fruit, and natural fruit, and how to use a blender and, make them. Then we had hip hop aerobics, where we had a We can use instructors, aerobic instructors to come in to teach about physical fitness, but in a fun way where you're engaging the children as well.
Right.
Emotional health, emotion therapy is very important, and it's important for families to be have access to a therapist. And we do have some therapists that we're connected with, but it's like some therapists, they're so overwhelmed, and they're literally burnt out. So it's like trying to find therapy. We definitely, if I would say at the top of the list, being able to connect with therapists, because we get a lot of calls where people they overwhelmed with just dealing with their journey, and then with family issues and just coping. And when it's like that, they need their spiritual health fed, and they need their emotional and mental health. And you can it can really get imbalanced if you don't get that support. And we do get I find myself sometimes being in a therapist capacity, or our chaplain, she has to act as a therapist, if we're not able to get connected. So yeah, therapy is really important. And um some of our clients, they don't have insurance, so they can't afford to pay for therapies. Like we have one therapist, he does group sessions. You can't get some people. Cancer is not like it's more of an intimate type of a one-on-one. You can't put a cancer survivor in a room with alcoholics and
Right.
people with gambling is you can't do that. And so we definitely need a person that's with a spiritual background, that has compassion for healthcare, that can also help a person, give them hope, give them the tools that they need to help
Mhm.
to get through it. Because I
Yeah.
mean, I've suffered from depression over the years, and I know that cancer is just another a dark cloud, and you got to have your emotional health in check.
Yeah. I really appreciate you sharing that. As of course, we all know that nonprofits need financial help. Like you said, you need to hire staff. It's, I ran a nonprofit for years, and it was very volunteer driven. But I knew that when the time came, I had to hire some staff members, and I was able to, through funding, hire four or five paid staff members, which made a big difference with lifting the load, because we were managing about 100 volunteers. So I know how challenging that can be, and I'm glad that you touched on the need for for that counselor. So honestly, if anyone's listening, and even if you're not local to Florida, you can do virtual counseling.
Yes,
You can do
yes.
virtual counseling. If you can give up 1 hour of your counseling time per week to just help this nonprofit out, it would be so great, because a big component of this journey, a big part of the healing, has to do with how you're dealing with the idea of the disease. And so I really thank you for sharing that. And of course, like you said, you have these baskets, and I know you'd mentioned to me that you put in the baskets, blankets, because you said you remember your experience at a chemotherapy room, where the people were being asked to share these blankets, and they didn't look very clean to you. So you try to give people who are going through chemotherapy some, their own clean baths, their own clean blankets. And you mentioned you give herbal teas in your baskets, and
And
maybe like
hard candy like ginger candy, stuff
ginger
to
candy
help
for the
with the
nausea.
nauseous, yeah, the nauseousness.
Yeah,
Um, just like coconut oil, just try to products that are kind of natural or therapeutic.
yeah, yeah.
And,
Again, if anyone's listening, and and you're touched by Tenecia's journey or story, I mean, the Pink Queen Foundation is a local advocacy group here in South Florida, not extremely heavily funded. But have some supporters, but they're doing the work and it's overwhelming. So you can donate to her baskets, you can donate your time for the therapy, you can
The
donate
Bridging
funds.
Families on a Cancer Journey. Yes, we definitely
Yes.
need hands on deck to come in to help us, because the work is out there, but we can't go out to the doctors, because we want to make connections with the doctor's offices that have these clients that have children that need our support. But if we
Hmm.
don't have the manpower, we
Yeah.
can't. We're limited of how often we can run these programs, and they are so essential and so needed. Like, for instance, we just finished up a program, and it was a mother, her daughter, and her grandson, and her disabled son. She was there every session. She enjoyed her daughter was very emotional, but she was so glad to be a part of the program. She learned a lot. But I just got a call back last week from this same lady. She went to the doctor because she wasn't feeling well. The cancer is back. It has metastasized through her entire body. And she said the thing about it that she just want to thank me and thank our organization for allowing her children to come in to get a better understanding of this cancer journey. And also they were able to meet other families. So not only are they going through to be educated, we're also giving them the tools to become ambassadors. you know
Right.
so um because it's a village, we have to bring the villages back. And sometimes it seems like it's taking cancer or something to help us bring these families back together, because
Yeah.
it's tough on family. It's tough on the kids. My kids, they went through a lot when I was going through it, so I can just imagine what. It's so many stories. I don't even want to cry, but it's so many stories that are untold that does not get any attention. It's
Hmm.
we helped with a family had to live in a hotel. She was evicted from her apartment because wasn't paying her rent on time, but she was going through treatment. She had to drive to Tampa to fight for her life. And meanwhile, she was a single parent. She had two high school young men in high school, so she would have to leave them home and go to treatments. And then so she wound up having to go on disability because her job let her go, and she wound up finding herself living in a hotel. So we helped them with their help her pay the hotels. Her car broke down. We helped her get a car fixed. We rented a car for her. She had things in storage. She didn't want to lose her store. We just kind of helped her, and she still, now her sons, they are working, thank God, to be able to sustain themselves, but she doesn't have a car, so they're ubering every day. So stories like that does not get they don't get told, and it's just a
Yeah.
lot. It's really a lot. So I'm not, I mean, yeah, the pink tutu and the cancer, all of that is cute and everything, but if you really want to know the journey of a cancer journey, you ask someone like me, because I have plenty of families that can give you a story, and you will look at that pink tutu or green or yellow, you'll look at it in a different light.
I thank you so much for coming on today, Tanisha, and for sharing, this important message. And as we're leaving, I know one of the things, I'll just leave you with 30 seconds, because I know when we came on, when we're talking in the green room, you said it's just so important about early detection. And we like to end on just a message, like a takeaway. And so if you want to just give that call to action about the takeaway about early detection, we're going to just let us end on that.
Okay, yes, it's definitely important. I would like just plead to the viewers, you're never too young to do a self breast assessment. You're never too young to know to understand your history. You're never too young. You got to know your history so that you'll know how to identify issues. And not all times cancer is hereditary. So you have to know your body, examine your body, you're your best advocate. And it starts with just you doing that self-examination. Once you do that, get your go through to get tested, then everything will fall in place. But if you don't do your self-exam, and if you ignore different pains or different things that look abnormal, it's you just pretty much headed for a bad situation that sometimes, most times, don't end well, especially in our community, because normally lots of times we've had some clients where they get diagnosed and they have to go to hospice because they're so far gone. Is because lack of knowledge, lack of just doing your own self examination. It's very important. You're never too young to do it.
Thank you so much, Tanisha, and thank you guys for watching. And if you're watching on the replay, we're gonna put Tanisha, what is the website address?
The website to the Pink Queen is
Yeah.
www.thepinkqueens
A Pink Queen. Okay.
with the S
Mhm.
dot
The
com.
Pink Queen.
Queen with the S, thepinkqueens.com.
Okay. QUEENS.
Mm-hmm.
Thepinkqueens.com. Okay.
Mm-hmm.
www.thepinkqueens.com. Anybody wants to find out more about your organization, they can check it out there.
Yeah, they can sign up
Tanisha.
on our mailing list, and
Yes.
they can get in contact with us, and we're here.
Yes. Thank you so much. Thank you. Just stay back while I just say goodbye to everyone. Guys, we'll see you on Wednesday for another episode of Tea Talks. Thank you for watching. Take care.
Thank you. Mm-hmm.